When a violent crime is committed and it makes the headlines, a common reaction is usually, oh, more bluntly, that person is just crazy, or maybe it's a mental health problem. Well, in forensic neuropsychopathology, this assumption is both misleading and oversimplified. Hey everyone, my name is Dr. Chouraeshkenazi, and I'm the CEO of the Chouraeshkenazi Group. I'm also an author, researcher, and professor, as well as a forensic neuropsychopathology expert. Now today we're going to separate myth from fact when we're discussing neuropsychopathological conditions and criminal behavior. And also I'm going to clarify what clinical research and forensic practice actually reveal. Myth 1. People with neuropsychopathological conditions are more likely to be criminals. This is actually one of the most persistent and damaging misconceptions. The reality is that most people with mental health conditions or neuropsychopathological impairments are not criminals and they don't engage in criminal activity. In fact, research shows that most of them are more likely to be victims than perpetrators. Conditions like epilepsy, traumatic brain injury, schizophrenia, or even bipolar disorder does not automatically lead to criminal behavior. Criminality is influenced by multiple factors that can include psychological, social, environmental, and even genetic. It's not just based on diagnoses alone. Myth 2. A mental health issue or neuropsychopathological condition removes legal responsibility. Now, many people may assume that a person with a psychiatric condition may not be held accountable for their actions, but a diagnosis alone does not determine criminal responsibility. Now, in forensic neuropsychopathology, the main questions are asked. Did the person understand the nature of their actions? Did they understand that what they were doing was wrong? Were they able to control their behavior at the time? Neuropsychopathological findings can inform courts about functional impairment, but explanation is not the same as excuse. Courts focus on capabilities at the time of the offense, not simply diagnoses. Myth 3. Psychopathy is a mental illness. Now, movies and true crimes often blur this line, and also it can be pretty tricky in an educational environment when you're understanding what psychopathy is, but it's actually not a mental health condition or disorder. It is a personality construct or trait. And when I talk about traits, I'm talking about characteristics. And some of the characteristics in psychopathy are lack of empathy, emotional detachment, being manipulative. And this is something that I discussed in a previous video when I discussed the difference between sociopathy versus psychopathy. Again, like I discussed in my previous video on psychopathy, there are different parts of components of the brain regions that shows the differences in emotional processing in people who possess psychopathic traits. And this can also be shown in neuroimaging research. But again, this does not predict criminality, and not all criminals are psychopaths, and not all people who possess psychopathic traits commit crimes. Myth 4. Brain scans can identify who will become violent. Now, this myth makes neuroscience seem like it's a crystal ball. As I mentioned again in two previous videos, one again the psychopathy video, and the other one where I talk about executive functioning, neuroimaging can show associations at the group level, and like I discussed, certain imaging can show hyperactivity or hypoactivity in certain areas of the brain. And these activity in regions of the brains can be correlated to certain behaviors such as impulse control and emotional regulation. However, certain neuroimaging findings cannot reliably predict who will become violent. Context and life experiences and other factors are what leads to criminal behavior. Now, something interesting. I will recommend that you all who are interested in psychopathy and learning about sociopaths and psychopaths, read this book by Dr. James Fallon called The Psychopath Inside. It's a very fascinating book how he, as a neuroscientist, actually stumbled upon his own neuroimaging and found out that he possessed the traits of a psychopath based on his imaging. I encourage you to read that book. However, clinical evaluations and forensic assessments require functional interpretation and not just images. And like I said again, it's not just based on diagnoses, and it's not just based on the combination of neuroimaging and diagnoses together. It takes more factors to determine criminal behavior. Myth 5. Neuropsychopathological conditions cause criminal behavior. Again, this is often an oversimplification that's repeated in the media and sometimes in courtroom commentary. And the fact is, neuropsychopathological impairments may increase vulnerability in certain circumstances, like chronic stress or substance use, or even having the lack of a support system, but they do not directly cause criminal behavior. And in forensic neuropsychopathology studies, it shows how cognitive, emotional, and behavioral functions interact with environmental and situational factors. And this is rather than claiming a direct cause-effect relationship. Misunderstanding the relationship between criminal behavior and neuropsychopathology can lead to stigma against individuals with mental health or neuropsychopathological conditions, oversimplify legal narratives in courts, reduce opportunities for prevention, treatment, and rehabilitation, and just having that accurate language and understanding can shape both public perception and forensic decision making. Neuropsychopathological conditions do not define criminal behavior, but by studying how the brain functions, cognitive processes, and mental health interact with social and environmental factors, it is critical for justice, rehabilitation, and prevention. In forensic neuropsychopathology, the truth lives in nuance, context, and functional understanding, not sensational headlines or simplistic assumptions. If you found this video interesting or would like to learn more topics in forensic neuropsychopathology, just leave a comment below. And don't forget to like and subscribe, and I'll see you in the next one.